Good afternoon, and welcome to all who are joining us today for this informational session about the Health Equity Challenge. Before we get started, I'd first like to acknowledge and pay respect to the Gabrielino Tongva peoples as the traditional land caretakers of Tovaangar, that is the Los Angeles Basin and South Channel Islands. My name is Catherine Keatsman, and I'm the director of the Health Equity Program here at the UCLA Center for Health Policy Research and an associate researcher in the Department of Community Health Sciences at the Fielding School of Public Health. We're so glad that you've joined us here today and are interested in learning more about the second phase of our Health Equity Challenge. This is an important opportunity to support students who are our next generation of leaders and problem solvers who are positioned to address health inequities in our society. In the next hour, we will share general information about the Health Equity Challenge sponsors, the program's purpose and goals, and more detailed information about the application process, review criteria, and components of the program. As we go through this session, when questions come to mind, please feel free to post them in the Q&A tab at the bottom of your screen. Again, in the Q&A tab, not in the chat section. And we're going to save plenty of time to answer your questions at the end of the session. So I'm first thrilled to introduce to you two exceptional leaders who are representing our partnership with the Molina Healthcare Foundation and the California Healthcare Foundation. Abby Totten is the Molina Healthcare of California Plan President, and Cara Carter is Senior Vice President of Strategy and Programs at the California Healthcare Foundation. They will be sharing information with you about their foundations, their commitment to advancing health equity, and their sponsorship of this program. Abby, we are so grateful to Molina Cares for bringing this fantastic program idea to us more than a year ago. It's been a bit of a whirlwind, and I can't even believe I'm pinching myself that we're here doing this again. And so glad that you could join us today to say a few words. Abby.
Thank you so much for having me today. I'm Abby Totten, Plan President for Molina Healthcare of California. For those of you who don't know the Molina Cares Accord, it's actually an independent 501c3 that Molina Healthcare established in 2020 and is really focused broadly on improving the lives of underserved populations. Since 2021, Molina Cares has distributed over $10 million across 23 states through 530 grants, and 3/4 of those most recently have gone specifically towards the social drivers of health and health equity related initiatives. For California, which is my home state, we're 100% dedicated to improving the lives of low-income populations and are particularly intimate with the challenges that face the communities we serve in Los Angeles and in the Inland Empire. The most fun about last year was just to see the incredible success of the first cohort of UCLA students. We were incredibly impressed by the creativity and the real world solutions that were proposed in last year's challenge. And we're incredibly grateful to partner again with UCLA and now with the California Healthcare Foundation to continue to expand upon last year's work on the existing projects and bring additional engagement to really drive change. We all know that we don't know everything, and it's only through the incredible partnerships and bringing great minds together that we are going to find really the right path to addressing health equity issues. And just extremely excited to be here and to continue to see the great work that the students across the UCLA team can do. So with that, Catherine, back to you.
Thank you, Abby, for the inspiration that you and Molina Cares continue to bring to this program. And now Cara Carter would like to share a few words on behalf of the California Healthcare Foundation. Cara?
I'm on mute. It's a sign of 2022. Thank you so much, Catherine. Like Abby, I'm just delighted to be here. I had the privilege of serving on the committee last year that reviewed these projects and was so inspired that at the end of the process, I went back and approached Abby and Catherine about whether or not CHCF could fully participate as a funding partner. I feel very grateful for the opportunity to do so. For those of you who don't know CHCF, we are a statewide healthcare foundation formed in the mid-90s. Our mission is to make sure that all Californians have access to terrific healthcare and terrific health outcomes. We make about $45 million of grants a year, and that's spread across the state. Too many Californians face structural barriers to care based on race, ethnicity, where they live, what language they speak. And like the rest of the country, California has long maintained policies, practices, and norms that are biased against Black Californians, Latinx Californians, Asian Pacific Islanders, and Indigenous people. So healthcare is one of just many of the systems that include housing, education, access to employment that perpetuate this kind of structural racism and lead to stark inequities in care and outcomes. But healthcare is my lane as a healthcare foundation, and health equity is the primary lens through which CHCF focuses our work. As a foundation, we look forward to a healthcare system in the future where all Californians can get the care that they need when they need it, where care is responsive and respectful, comprehensive, and coordinated for all Californians, and that the healthcare team itself represents the diversity of California and is trained and supported to deliver culturally and linguistically appropriate care and care without bias. There are lots of different ways that CHCF engages in this work. If folks are interested, I'm happy to answer questions. I'm happy for folks to reach out to me, and I would encourage you all to have a look at our website. Last week, we put out a survey, probably the largest survey of its kind, of Black Californians and their experience of racism in healthcare to help the healthcare providers and other decision makers understand how to better improve their care. We do a ton of work over the last 20 years really on trying to overcome barriers to access to coverage. So really, since the implementation of the ACA in California, that's focused on removing immigration status as a barrier to accessing health coverage, particularly Medi-Cal coverage. Really pleased with the progress the state has made over the last few years. And then we do a lot of work in the delivery system on anti-racism tools, on implicit bias training, on ensuring the community-based workforce is proximal and relevant and part of the healthcare team. And finally, we do a lot of work right now on reaching out to both policy leaders of the future, delivery system leaders of the future, and entrepreneurs of color. And that leads me to part of what has been so inspiring for me about this program. So I could not be more excited both to be engaged with the kind of projects that this program generated last year, but also with a group of students who I really think are the leaders of the future. The folks that are coming up with the ideas and creativity and intimate knowledge of how to solve these deep inequities and deep-rooted structural problems. So it is with both joy and privilege that I look forward to supporting this program, and I cannot wait to see what this year brings. Catherine?
Thank you so much, Cara. We're so excited that you and the California Healthcare Foundation has joined and enhanced this partnership and program. And we so much appreciate the critically important work that both Molina Cares and the California Healthcare Foundation are supporting, and are so excited to continue with our second round of the Health Equity Challenge. And with the combined support of the two foundations, we can now support 15 student scholars, up to 4 community-based organizations, and we're expanding the reach beyond Greater LA to also include projects in Riverside and San Bernardino counties. So that's really exciting for us to already have growth in this program after less than 1 year on the calendar. And we're going to talk a little bit about calendars and this application process in a moment, but I do want to first recognize other members of our team who are helping to lead the Health Equity Challenge on the ground. From the UCLA Center for Health Policy Research, delighted to be joined by one of our co-leaders of the program, AJ Scheitler, who's kindly serving as today's moderator. She also serves as our Center Director of Stakeholder Relations. She wears many hats. Also joining us today as representatives of Molina Cares are Susan Shin, Brianna Janoski, and Cleo Cordominus. Two more team members who are not able to join us today, but definitely deserve acknowledgement are Tiffany Lopes, our communications director here at the Center for Health Policy Research. And she's another co-leader of the UCLA team. And also Stephen Summers, an independent consultant who's been involved with this since the onset. And he's the founder and former president of the nationally renowned Center for Healthcare Strategies. I believe you're going to find most people's bios in the chat, and they're also posted on our healthequitychallenge.com website. So there are many definitions of health equity, but I think that this definition from the CDC, Centers for Disease Control and Prevention, really set up our discussion of the purpose and goals of the Health Equity Challenge quite well. The Health Equity Challenge is looking to you, our future leaders, to come up with innovative ways to achieve and to ensure that there are opportunities to attain one's full health potential is realized, and to eliminate disadvantages to achieving this potential due to social position or other socially determined circumstances. Through your applications, we're seeking innovative ideas for community-based programs, policies, campaigns, or interventions that address an issue of health inequity that you've identified in a local community. We're asking you to identify health equity to be addressed. Some examples include increasing access to health care or long care services, enhancing quality of care, improving healthcare outcomes, especially among historically disadvantaged populations. The programs that you come up with must be able to be implemented for less than $50,000. So we're asking you to think about a huge issue, but we also want you to come up with a very manageable solution that can be applied at a local level. The competition is open to UCLA graduate students from any school or department that makes you eligible to apply. Your 2-page application is due by October 31st. That's 2 weeks from today.
Catherine, your audio has disappeared.
Okay.
Um,
Let me try something. Can you not hear me now?
we can hear you. We can hear you. You sound like you're far away. We can hear you.
Okay, let me try taking off the earphones. Sometimes that makes a difference. How about now?
We can hear you. That is better.
Recording in progress. Hi, can you hear me on my phone?
Yes, Catherine, we can hear you.
Okay, apologies about that. I'm getting an echo. Are you getting an echo?
No.
Okay. Okay, so I will continue and hopefully you don't hear the echo that I hear.
You do not. Go for it.
Okay, great. So I believe I was up to the part of talking about round 1, which is the 2-page application due October 31 by 5 p.m., 2 weeks from today. 15 students will be selected from this first round 2-page applications, and those 15 students will be invited to develop proposals. The mentoring program, the 15 students will be announced in mid-December, and the mentoring program will begin in early January 9th. The final proposals that the 15 students will develop will be due on April 28th, 2023. A little bit more about the 2-page application. You can find it at our healthequitychallenge.com website. It's pretty straightforward. We ask you a few questions about yourself, and then we really want to understand your vision for why you would like to participate in this program. What is your motivation for reducing health inequities? What is it that it inspires you? to tackle these problems that you've identified. Tell us a little bit about the types of innovations that you are thinking about. Also, ideas for who would be a good community partner. That's a very important part of this application and program process, is to really figure out how you can work collaboratively with a community partner to implement an idea that's feasible for them to implement and reflects your ideas about what might be a solution. We also look for you to identify a potential mentor if you have one in mind. This can be a faculty or a community-based mentor. But if you can't find someone or identify anyone at this stage for this 2-page applications, we will help you identify a mentor once you're in the program. And then we ask for you to include a CV or resume and upload that to the website. Once again, applications are due October 31. We've put together a panel of independent reviewers, meaning that they're not affiliated with UCLA or with the UCLA Center for Health Policy Research. And this group is comprised of state and health and local health policy leaders, program executives, administrators, planners who have a deep understanding of community and health disparities. Again, 15 applicants will be invited to compete in round 2, and we'll announce in mid-December. So it's probably important that you understand how these applications will be evaluated. And there are really 3 major concepts to keep in mind as you develop your application: clarity of purpose, the potential impact of your idea, and the feasibility of implementing your idea. These are the constructs that will guide the reviewer's assessment of your applications. So let's take a moment to look at each of these individually. So for clarity, you want to be very clear about your purpose and your focus, both when you identify a specific health equity challenge and when you propose a community-based solution. Second, with impact, you want to demonstrate how your idea has the potential to move the needle on health equity challenge you've identified. You want to illustrate why you think it's likely to make a positive change, especially for historically underserved and under-resourced populations. And often ideas that are the most successful are innovative. They may take a novel approach to an existing problem, perhaps approaching a particular problem in a new way, or trying an intervention in a different or non-traditional setting. And then third, feasibility. It's critically important that the idea is practical and is something that can be contained in, with a budget of up to $50,000. And it's something that the CBO has the capacity to take on and implement successfully. So you need to think through very carefully what's doable, given the resources that will be allotted. And you also need to think carefully about designing the program or intervention, or using an approach that will appeal to your target population, something that they're likely to want to participate in or be engaged in. The program, for the 15, here are the components of the program. The 15 students will be invited to develop proposals. Each will receive a stipend award of $2,500. We will start with a mentor-mentee orientation. It'll be very early in January after the quarter starts. That will be followed by 15 weeks of mentorship and training. Part of that mentorship and training will involve guidance on how to develop your proposal, grant writing tips, assistance identifying a community partner, review of some really high-level but important health policy topics. We're inviting students from all different schools and disciplines. So we don't assume that you have come in with all of this knowledge, but you do have an identified health equity issue that you feel that you can develop a solution for. Other topics may include how to translate your research to policy and practice. And then all students will be asked to write a blog about their experience while they're in the program, and to share some of the insights that we hope you'll gain from your participation. Again, the final proposals will be due at the end of the 15-week mentorship program on April 28th. And then in early June, up to 4 winners will be announced. Community partners who are named in the winning proposals will receive a $50,000 grant from Molina Cares or the California Healthcare Foundation to implement your innovation. And then the final student winners will monitor implementation, share outcomes with the funders, will also be asked to present their winning idea at a conference or to the next class of Health Equity Challenge scholars. I think I neglected to mention that the 4 winning proposals will also receive an additional $2,500 stipend. So here's just a repeat of the important dates for this cycle of the Health Equity Challenge. Applications opened last week. Applications are due 2 weeks from today, October 31st. Mid-December, 15 students will be announced to receive the $2,500 stipend, 15-week program, January through April. And then 4 winners announced at a nice award ceremony, and where all 15 students will have an opportunity to present a poster that summarizes their idea. What we saw at last year's Health Equity Challenge, there's so much interest in the attendees at the award ceremony. They really wanted to know more about all students' ideas. And so we came up with an idea that should make this a little poster session at the end of your event. So that sums up the program information I have for you today. And it's just 22 minutes after the hour, according to my phone. So we have lots of time for questions. I'm going to turn this over to AJ, who's going to moderate the question and answer session. Thank you all for being here and looking forward to discussing this some more with you all.
Yes, so we have a couple of questions already, but if anybody else has any additional ones, please utilize the Q&A function and we will get to all of them. All right, first off, Catherine, will there be a round of interviews in the application process?
The answer is no, there's no interview as part of the application process. It's the 2-page application, resume, good ideas, well-formulated, clarity, feasibility, impact, and innovation.
Great. Next question, for the potential mentor section, do we need to provide a mentorship plan and or the mentor's qualifications, or can we just provide their name?
Great question. Providing their name at this stage of the process is perfectly fine. You might want to indicate their affiliation. So I mentioned you could name a faculty or a community mentor. So indicating where they're located would be helpful. But I think that's all you really need to provide at this point. We'll have sort of a level setting with all mentors at the beginning of the year to clarify our expectations of them and the role that they're assuming with you.
Yes, affiliation is helpful because if we do want to eventually reach out to them about being your mentor, we need to find a way to contact them and understand what their qualifications are. So it is definitely helpful to provide that information, but a full justification for them is not necessary with your application.
Yeah, thanks, AJ.
Yes. Next question. What ideal qualities are you looking for in the candidates and proposals that move to the next round?
Well, we have sort of set up these constructs that the independent review panel will use to evaluate your proposals. But I can say that we had such an incredible class of scholars last year. I think that, you know, having an understanding of why this work is important, why it's meaningful, how you are connected to it, and being very, you know, articulate about why the population of focus really needs the idea and the program idea that you're bringing. So it's, you know, we know that you're all graduate students at UCLA, you're all very smart people. There's no doubt in our minds about any of that. I think this is an opportunity to focus on this particular area. And it's an opportunity, I think, for you to work on grant writing skills, but also just to really advance your own your own research or your own focus in your graduate studies and make it applicable out into a real world opportunity for change. So I said, I think if you can communicate that in your 2-page application, those are some of the qualities that we're looking for, and that I think that the independent review committee will respond to. In addition to those 3 major constructs of making sure that, ideas and passion are really important, and most everybody who applies to this program, who applied last year, has tons of passion. But the next step is to also provide a very well crafted idea of your solution to the community problem. Now, I'll say that in a 2-page application, we're not, sound like we're expecting the moon and the sun and the stars. And of course we are, but the full proposal is where you'll have the opportunity to go into a lot of that detail. We recognize there's 2 weeks to do this application. So give it your best shot, and show us your passion, but show us your ideas as well in a clear way.
And the next question is, by the 2-page application, do we mean the 3 questions that are in the portal, or is there another documentation that we should submit separately?
Thank you for that question. So for those who haven't visited the portal, there are 3 major questions that we were asking you to draft narrative in response to. There are suggested word lengths for each of those. So the short answer to your question is, that's it. It's the answers to those 3 questions. That's really the meat of the 2-page application. The resume, we're not counting that. Obviously, you might have a longer resume than, that's supplemental material. And then the other material is just your basic application, contact information, and some demographic questions about you and your school and your department, that sort of thing.
Okay, so at the moment, that is all the questions that we had, but we still have time if anyone has thought of anything else that they would like to ask. We are still available. Or Catherine, your email is up there. Do you have any other words of wisdom that you'd like to share as we?
I think if you go to the healthequitychallenge.com website, you'll learn about the students who participated last year and about their ideas. I think if there's anybody else still on the panel who would like to add any more comments in response to any of the questions that were raised, perhaps your perspective on, the qualities we're looking for, please feel free to jump in. We also have other team members who weren't on the panel. Happy to hear from you as well. So, want to make sure everybody has a chance if you want to add some additional words of wisdom for our audience today.
We did just get one more question in. The question, can we have co-mentors and co-advisors?
Co-mentors, yeah, actually, if that means multiple mentors, yes. Yes, you can definitely have more than one mentor. We encourage you to have a primary mentor who would be the person most responsible for shepherding you through the process. And, we ask the mentors to plan on spending a minimum of, an average hour a week to be available to answer questions you may be having as you're developing your proposal. But we recognize that, different mentors can offer different value and different types of feedback depending on where they sit. So yes, you can definitely have more than one mentor, but we'd ask that you name a primary mentor for the purpose of the program.
Another question, are proposals limited to physical health equity? Would addressing mental health equity in access and care qualify?
Absolutely. Thank you for raising that question. Health is defined very broadly, and it is not restricted at all to physical health. Mental, behavioral health, environmental health. We are thinking very broadly. Health is also where we live, where we work, where we play, and we know that social determinants and the access we have to resources shape and affect our health outcomes. And so we encourage innovative ideas and the full range of topics that really fall under that broad umbrella of health. thank you for asking. That's an important question.
Another question has come in. Do we have to identify a community partner in our proposal that are likely to implement the intervention?
If you have already have an idea and a relationship with a community-based organization, that's great. And you can be that specific if you're ready to be that specific. But we recognize that I think it's fair to say for most of the applicants and the students who participated last year, they had to develop those relationships in many instances, and that takes time. And so we don't expect you to have all those answers. And we're also available to help support your finding community-based organizations that you'll need to approach. You'll need to probably consult with them a few times to see if they think your idea is something they could take on. And so we encourage that process to start really early on in the program. We have expanded the length of the program this year. Last year it was over 10 weeks. So it was an extremely short period. This year it stretches over 2 quarters, over 15 weeks. We're hoping that helps increase the time that sometimes is needed to have those conversations and to determine where your idea is going to find a good match.
I would also add to that it's helpful to talk to the organization to understand what their capabilities are. And they work in the space that your idea is going to be implemented in. And so they can often provide you excellent feedback as to what definitely works or what maybe needs a little tweaking within the idea that you have that's actually realistic for them to achieve. So if you're able to identify someone and establish that relationship, they can provide you with excellent feedback as to your proposal and as to the kinds of feasibility that it has going forward, and that always enhances a proposal. So again, it is, as Catherine mentioned, it is not required, but if you are able to identify one, that having that feedback can strengthen your proposal. So I encourage you to at least try if that's at all possible.
Well, thank you.
Next question, will a recording of this webinar be made available?
Yes, we're recording the webinar and we're going to post it on the healthequitychallenge.com website. I'm not sure exactly when it'll become available, but I think maybe by the end of the week. As soon as we can get it up there, I'm sure we will.
Okay, and once again, we have reached the end of all of the questions that have been posed so far.
Great questions. I encourage, if you have other thoughts, other questions, you can shout them out now in the Q&A. You can send questions to me by my email address. Take a dive into the website. Any other comments from any of my fellow panelists today?
Oh, we got one more interesting question. How many people applied last year?
How many applied? More than a few dozen. More than a few dozen is what I recall. Yeah. So I want to say it was somewhere ballpark of 24, 25. And we had 10 slots, so to speak. We had 10 applicants that were selected. We don't have a way of knowing how many are going to apply this year. I think some people, certainly there's been a good amount of promotion about the program over the last several months. So we may expect a bigger applicant pool. But every application will be read carefully and evaluated carefully. So please do submit your applications. We really want to hear from you. We want to hear your ideas.
Okay, Catherine, no further questions have come in. If that is what, oh, wait. Oh, perennial question. Can you submit more than one application?
Yeah. You can if you have two very, totally distinct ideas. Yes, you can. We don't want to discourage your ideas. So yeah, they just have to be very distinct ideas.
Okay, that may actually be all the questions now.
Okay.
I mean,
it's
any more
okay.
coming
Keep
in at the
rolling in.
moment?
Sometimes it takes a moment for folks
Yes,
to
yes.
articulate them. We can give another minute just in case somebody's typing away.
I don't see anything but a thank you in the chat.
Okay. All right. Well, thank you all for attending today. Really appreciate your interest. We look forward to reading your applications, getting your applications, giving them to our review committee. Thanks again to Abby Totten and Cara Carter from the Molina Cares Foundation and from the California Healthcare Foundation for being such champions for this work, for being such a wonderful resource to our, implementation of this idea and this program. So really appreciate you all. Looking forward to the next round. Thanks, everyone.
Agree. Thank you.
Take care.